Okay, so today we're talking about the importance of zinc and why you may want to consider taking zinc in the form of a supplement. You know, zinc is a mineral that's found predominantly in red meat, but zinc can also be found in many nuts and seeds, shellfish, eggs, dairy. The problem is that there are a lot of populations out there that are deficient in zinc. In fact, most commonly, populations that are deficient in zinc would be children, elderly people, pregnant women, or women that are nursing their baby. And so when you're deficient in zinc, it affects a lot of different things. You know, zinc is critical for your immune system, zinc is critical for your nervous system. And so there's actually a really interesting study that came out in 2020 that got published in PubMed, and it was relative to COVID-19. And so what they found is that people that were deficient in zinc had poor outcomes when they, were infected with COVID-19. In fact, the reason for that is one of the benefits of zinc is it helps prevent viral replication. So when you're infected with a virus, and this happens all the time, by the way, it's not just with COVID, but every year, we're coming into cold and flu season right now. And so without fail, all of us most likely are going to come into contact with a cold or a flu virus. And the importance of zinc is zinc stops the replication of viruses inside the cell. So basically, think about it this way. Your body comes into contact with a virus, and the only reason why you end up getting sick from the virus is because it grows and it replicates, meaning it makes more of itself, and eventually it makes enough of itself to where it affects the function of your body, and your body becomes sick. And then that's when you get cold and flu-like symptoms, because that's your body's natural way of trying to expel those viruses, or that virus and its replicated parts. So zinc stops that process. And so one of the really neat things about the zinc supplement that we're talking about today, and obviously, like I said, the best way to get zinc is through whole foods. So things like red meat, shellfish, eggs, nuts and seeds, dairy. But even still, if you're susceptible to colds and flu, or you're one of those, you're in one of those populations that I talked about previously, children, elderly people, pregnant moms, breastfeeding moms, there's a high likelihood, even if you eat a really clean diet, that you're still deficient in zinc. Now, there is a way to test your levels, and we offer that through the clinic. It's through a program called Metabolics. But if you haven't tested, or you think you may just be susceptible to that, then I would highly recommend taking a zinc supplement. Now, this isn't something that you've got to take all the time. What I would recommend is take a zinc supplement if you feel like you've been in contact with someone who was sick, or you've been exposed, or early onset symptoms after you've already, gotten sick, so to speak. Taking this towards the tail end of when you're sick doesn't do you a whole lot of good, because at that point the virus is already replicated. So the zinc supplement that I'm talking about today is called Zinc Supreme, and it's called Supreme because it's not just zinc. So what this also has in it is B vitamins and molybdenum, and it also has taurine, which is an amino acid. So the reason why these additional elements in the zinc supplement are really important is because B vitamins have been shown to help your body retain zinc so that your body doesn't excrete the zinc. So basically, what that means is, you could be trying really hard to increase your zinc levels through proper diet, maybe even through supplementation. But if you're low in B vitamins, most likely you excrete a lot of the zinc that you're consuming, either from foods or a supplement. So having B vitamins along with your zinc helps your body retain more of the zinc. The other thing that's in here is molybdenum. Now, molybdenum helps activate zinc in the cell, and it contains an enzyme that helps to break down the molecular structure of the virus. So the protein structure of the virus, molybdenum plus zinc, help to break that protein structure down. And then the taurine, the amino acid, helps to make the zinc more bioavailable for your body, meaning your body is a lot more able to digest and assimilate and then use the zinc that you take versus if you take it just in a raw form. Now, what that means, essentially, if you're into this kind of stuff, is this is a chelated form of zinc. It's bound to amino acids, which makes your body, makes it a lot more bioavailable for your body to use, versus if you just took a zinc supplement all by itself. Now, again, ideally, you would get your zinc from food. I've said it before, I'll say it again. red meat, shellfish, eggs, nuts and seeds, dairy. But again, even if you eat a really clean diet, if you're in one of those populations, if you're a kid, if you're an elderly person, if you're pregnant, if you're nursing, most likely you're deficient in zinc. So if you have questions about this, be sure to ask one of us. We have this available for patients. If you have a brand that you really like that you want us to check out just to see if it's a good brand for you, we're more than happy to do that as well.